The following is brought to you by Vertical Vet. Rethink your GPO.
Hello, Vertical Vet family. I am Dr. Ernie Ward, Chief Veterinary Officer for Vertical Vet, and it's my highest honor to welcome you to another one of our Vet Med School webinars where we try to teach you the latest and greatest in medicine. And once again, this week, we've got our dear friends over at HT Vista to talk about some exciting new technology to help you scan and detect cancers. I mean, we all know the old palpate, aspirate, biopsy, but what if we could do that differently? What if we could detect certain cancers, screen them out in 40 seconds or less? I mean, guys, this type of technology is revolutionizing the way we address cancer, lumps, and bumps in veterinary clinical practice. And again, I am super excited to introduce you to one of the heads over there, the managing director of HT Vista, Dr. Liron Levy-Hirsch. And again, he went to the Hebrew University in Israel, graduated back in 2007, and then he did a small animal rotating internship at the Hebrew University Veterinary Teaching Hospital. After that, he moved to the UK and London, which is where he is calling in today from, and he said, you know what, I want to take this to another level. He wound up practicing in emergency and critical care for about 12 years, and then in 2023, he decided to join HT Vista as their managing director. And I got to tell you guys, this is quite an exciting technology. And if you're like me, you know, you've been in practice for a few years, you know the challenges of kind of giving peace of mind and clarity to those patients when you palpate that lump or bump. But Liron, you guys are completely changing the game when we think about how we will address those lumps and bumps in clinical practice. Thank you so much for joining us again.
Thank you for having me. Appreciate it.
Well, listen, at the outset, you know, we know that a lot of things are changing in how we address those lumps and bumps. And as I mentioned, you know, typically we're used to, as general practitioners, you palpate a mass. Then you have to make a decision. Do you want to aspirate it? Do you want to wait and see? Maybe if it's really suspicious or concerning, or you have a client who says, I really want to know, you might biopsy it. But there's a new step that's really exciting. So maybe just at the very beginning, explain to us what you're doing with this whole HT Vista, you know, imaging.
Yeah, absolutely. So basically the HT Vista, which I can show you, there is a slide just to show how the device looks like, is basically what we're offering is a new category of care. As you mentioned before, we are all used to aspirate, you know, and then kind of follow the routine stuff. But what we are offering today is a new tool that uses a new technology called heat diffusion imaging, which helps us differentiate between benign and malignant tissues on the spot. Within a 40-second scan, you get the results within 2 minutes. And then you can make a very conscious and evidence-based decision for your patients together with the pet owner that is there and there. You don't need to chase them. And the technology allows you to make, like I said before, an evidence-based decision and offer the best care for your patient.
These thermophysical properties, right, of these tumors. I mean, maybe start there too, Liron. Why would this work, right? You heat up tissue and then you watch how it cools back down. Why would that help us detect, you know, certain types of cancers? Malignant versus benign would be my first issue.
Yeah, absolutely. So another slide for you. As some of you might know, each biological tissue has a heat capacity that is based on the fact that it has different blood supply, density, structure to the cells. There is all kinds of anatomical, biological, and metabolical reasons why different tissues have different heat capacity. And therefore, when they are exposed to heat, when there is a heat wave that excites the tissue, it allows the tissue to respond in a different way. And these are exactly the changes, the features that we are tracking and identifying. And because obviously the technology is very complex and complicated, we have also developed an AI algorithm, or actually a few algorithms that know to differentiate between those signals and know to differentiate between benign and malignant tissues and give us the answers very quickly so we can make a decision on the spot.
Yeah, and again, guys, this is remarkable because what we're faced with, especially during economic times like we're facing around the world right now, are cost barriers. And, Laurent, as a general practitioner, a lot of times I want to do a biopsy. I would like to get an aspiration, but quite frankly, the owner just can't afford it. So I do think that cost can be a barrier to actually diagnosis. So explain how this works, right? Because this is going to be faster. I can allow a veterinary technician, a credentialed vet nurse to do this, and in 40 seconds, explain to us how you believe that HT Vista can actually help us screen more dogs for these tumors.
Absolutely. So you're absolutely on the spot here. Cost constraint is an issue, and we know from studies that we've done, from surveys that we have run, that hopefully our audience will appreciate and agree with us, about 50% of pet owners will decide not to do anything, decide to wait and see. So what we are doing here, we are offering a tool in hope to end the practice of wait and see, and allows those pet owners a very efficient, quick way to understand what the best next step is, whether to do a biopsy or to maybe wait and see what happens. But at least the decision is made based on evidence. And I have a short, very small slide to show the process that what we have seen works in a veterinary practice. That I think you've mentioned that as well. The technicians have a major part in the process. So by allowing the technicians to take responsibility for the scanning process and perform the scan and get the results before the full vet consultation, the whole process of management of lumps and bumps becomes much more efficient, much easier for the pet owner and the vet team, and saves a lot of money for the pet owners that maybe initially, because of cost constraints, wouldn't want to do anything. Then they agree to do the scans, they get the results, and when we'll talk about it in a moment, the result comes back as a high cancer risk. It's really hard for the pet owner to decline further investigation. So by that, we are actually taking the proportion, the 50% of pet owners that don't want to do anything, we're actually now able to convince them to do more. Because the last thing we want to do is to send patients home with cancer.
Again, Laurent, I want to get back to the cost, but there's also another issue with the invasiveness, right? So some pet parents are hesitant to do a biopsy, right? They're fearful of sedation or anesthesia. I mean, I'm not saying these are founded fears, but the reality is they say, you know what, let's just wait and see. This is, again, helping overcome that barrier to getting better clinical evidence. So, maybe, again, walk us through how it works, because, I mean, it's remarkable, guys. I really want you to schedule a lunch and learn to learn about this, because it's a handheld device that your veterinary technician can hold up against the lump or bump, and it takes 40 seconds. It does a little mild heating of it, and then it measures the signal, what it looks like on the infrared coming back. I mean, Laurent, this is remarkable. Non-invasive, 40 seconds, you're getting an answer, and it helps you then make the next steps.
Yeah, absolutely. And, I think it's probably best if I explain about how it works again using the slide that I have. It shows how, for example, we are detecting mast cell tumors. So like I said before, each tissue has a different heat signature. And for example, a mast cell tumor has a certain way it warms up, and also quite interestingly, the way the tissue cools down over time. So like you mentioned, the 40-second scan, which includes 10 seconds of heating, very mild heating, pain-free for the patient, very comfortable, and then followed by a cooling down period of 30 seconds. And you can see here, this is obviously just a demonstration, because it's much more complicated than that, but you can see the process, how the tissue gets heated and then cools down. And what you can see on the left top corner is a mast cell tumor that you can see kind of in the optic camera. And quite interestingly, what we are showing you on the bottom corner, left corner, is how it's the thermal properties of the tissue before it gets heated. So you can see that within the first circle, the first marker, the blue marker, that's where the mast cell tumor is. The tissue is already much hotter than the surrounding tissue, which is the blue area. And what the device actually does, it uses the blue area, the healthy tissue, as a reference point to let us know what it thinks about the area that is included within the first market, the blue market. So in this case, the algorithm concluded that there is a high cancer risk in this case. And also with our new subclassifier, the new detection tool that we have, it is also able to provide a diagnostic alert to say, you know what, it's not only high cancer risk for this mast, potentially we're also dealing with a mast cell tumor. So it can really dictate your next steps. Do you want to take an aspirate, or maybe you want to take a biopsy instead, or maybe you want to give antihistamines before you aspirate. So you can really make a conscious, evidence-based decision on the best course of action to offer the best possible care for your patient.
And again, guys, this is transformative, right? Because we've all been there. You palpate a little pea-sized nodule somewhere. You hope it's not a mast cell tumor, but you have no way of knowing because I don't have a microscope in my fingertips. And so suddenly now I can literally in a couple of minutes tell you with a high degree of accuracy whether or not this is likely to be a malignant versus a benign tumor. I mean, have I got that right, Laurent?
Yeah, so if I show the next slide, I've prepared lots of slides, as you can see. The way we are translating the language, we are kind of using, obviously the language that the algorithm is using is very complex, but we are translating it to a language which is easy to analyze, easy to interpret, but also easy to communicate back to the pet owner. So the output of the algorithm is actually a cancer risk, and each mast will either get a low, moderate, or high cancer risk, and in some cases, a diagnostic alert, for example, with the mast cell tumor. And this language is so easy to communicate, and pet owners kind of really understand, and appreciate the outcome, the results, that they can make a decision on the spot. So this is how we communicate in a very easy way, a very complex process.
Right. And that is critical, guys, to success in the exam room, is being able to take something very complicated and quite frankly frightening, right? Cancer. I mean, anytime you say lump or bump in the exam room, you've all been there, right? I mean, people go, whoa, wait, what? And so they go to the worst catastrophic conclusion. And now you're able to give that peace of mind that I alluded to earlier on. I do want to also speak to some of these subclassifications, because what has happened in my experience with HT Vista over the past year or so is you guys are getting more and more refined in the process. So now we've got these subclassifiers. So maybe explain to the vertical vet family what that means. I mean, now it's not just it's more than likely benign versus malignant, but you guys are going to level deeper, just like they are in human medicine.
Yeah, absolutely. So until we developed the subclassifiers, and to be able to develop the subclassifiers actually came from the fact that we've managed to collect loads of data over the last couple of years. If it's oncologists that we work with or GPs that we work with that contribute and want to be part of this community of helping the algorithm become better. So on top of the screening algorithm that provides a cancer risk, we have developed new subclassifiers that allow to provide a specific name, a specific type of cancer to the lump that is being scanned. So currently we have 4 subclassifiers. I guess the most kind of common ones are for lipomas and mast cell tumors. And so the lipoma subclassifier can detect lipomas at a very high specificity, over 90% specificity. The same for the mast cell tumor. It can detect mast cell tumors over 90% specificity, which gives either reassurance very quickly to the pet owner that yes, it's not only low cancer risk, but we are also dealing with a lipoma here. So another kind of layer of reassurance that they are making the right decision not to proceed with any kind of further test. Or when it comes to the mast cell tumors, obviously gives enough evidence to highlight the risk, but also provide evidence what to do next in terms of diagnosis and treatment.
Yeah, and again, maybe speak a little more about the specificity and sensitivity.
Yeah, so let's start with the second question, because that's easy. The rule of thumb for us is anything that you can actually aspirate, you can scan, as little as 3 to 4 millimeters. Very, very little kind of masses. And in terms of the performance of our algorithms, we are talking about a sensitivity of 90% but most importantly, the negative predicted value of our screening tool. The negative predicted value of our screening tool is 98%, which is very, very high for a veterinary equipment. And on top of that, the sub-classifier that we are currently working with show a performance of over 90% specificity. So 98% negative predicted value. So when we say it's negative, when we say low cancer risk, benign, 98% chance that we are correct. And when we offer a diagnostic alert, such as lipoma or mast cell tumor, the specificity is 90% or higher, and that's how kind of likely for us to be correct when we offer this diagnostic test.
Right. And again, guys, you probably are just now becoming more familiar with NPVs or negative predictive values because of AI in medicine. I mean, so that's one of those things that's kind of being transferred over to us in medicine. But that's astounding, 98% NPV. So basically, Laurent, what you're saying is if it says it's benign, I mean, this is about as good as it gets.
Absolutely. 98%. Wow. I mean, I'm happy with that.
Oh, right. And again, this is a 40-second scan, guys. And let's just say for some reason that you said, well, even though it's 98% negative predictive value, I don't agree with it. You now have more evidence if you really choose to do so to do an aspirate or biopsy or whatever. I just think this is fascinating. Again, Lauren, I want to get back to, how this really impacts our patient care, because I know there are several cases over my almost 35 years in the profession where I wish I could have done something sooner. I felt a lump or bump, and the dog owner just said, right now is not a good time for me. I'm going to have to wait or whatever. And then I saw him, 6 months later, and it was too late. Maybe explain again back to that workflow. Like, how would you communicate that to help encourage that pet owner to say, number one, we need to do this. Number two, this is a very valuable, fast, non-invasive process, right? Because those are two issues, right? We need to do it, and this is easy to do. Maybe how are you using that to communicate in the exam room? Because I know you're doing this, frequently.
Yeah, absolutely. And I think it's really important what you said, because our main aim is to reduce the time, or to minimize the delay between detection and intervention. And the way we do it by offering a non-invasive, quick, efficient, pain-free procedure. And the way we do it in the consult room, to be honest, the way we have seen it working much, much better, like I said before, when the technicians take responsibility for the process. So as a doctor, I would quickly have a chat with the pet owner. And to be honest, it's the whole team that has influence on the process, from the receptionist that booked the appointment to the veterinary surgeons, obviously, and the technicians. But as a doctor, I would try to avoid as much as I can sending patients home to wait and see, and try to offer them and explain the values of the device. And like I said, it's a very small clip of kind of patch of hair that needs to be done, but otherwise it can be done very quickly, very efficiently. It's pain-free, just a few degrees above body temperature. There is no side effects whatsoever that we've seen. And like I said, it can be done by the vet technicians, which is really, really improving the whole kind of process altogether.
Yeah. And again, if you're a practice owner like me, I mean, we're now able to improve our profitability. I don't like to talk about that in terms of cancer, but the reality is by us doing all of this in clinic, we're not sending out to the lab. And, and again, let's face it, guys, our laboratory costs continue to skyrocket. And so I think that there is a strong economic argument to be made for bringing these types of advanced technologies in the clinic. And again, since it's very fast, it speeds up the process. I can offload this to my credentialed veterinary technician if appropriate. And again, you're welcome to do this as a veterinarian. In fact, I would encourage you to do it, the first few times as you get familiar, because what you're going to find is, like me, it is incredibly easy to do. I mean, this is a handheld little device that you just put it on there it heats up for 10 seconds. And I mean, this whole process it's amazing. It's fast. So please book a lunch and learn, because I think you're going to be just as impressed as I was. But, getting back to that revenue model, I mean, Laurent, how expensive is this? I mean, can you give us any sort of, guidance on, how is this profitable in the end, I guess I should say?
Yeah, absolutely. And I think it's just one more kind of important point to make, and I think you've mentioned that, we as veterinary as vets and doctors, we don't like to talk about money, but money is important. The one kind of key message that I want to make is that, we are offering a device that helps clinicians to fight, if you want, the practice of wait and see. So we are trying to avoid patients going home doing nothing, basically, then doing what actually they deserve to get, and that is improve the patient's outcome. And as a result, because we are taking this kind of group of potentially patients that go home doing nothing and offering them, and they agree to do more, that's where the profitability comes, and that's where the practice growth comes, because we want to improve the practice, we want to offer better care for our patients. So the cost of the device, we offer the device to purchase. The cost of the device is about $14K. Roughly, kind of again, as a guide, we don't normally intervene with practice structure of practices. Every practice can decide on their own kind of practice. They charge anything above, on average, between $50 to $60 per scan. But the important bit to remember here is that returning the investment or paying back for the device doesn't necessarily come only from the scan. So to be honest, mainly come from the additional surgeries that you will do. So an average clinic would probably need to do about 7, 8, let's say even 10 new surgeries to cover the cost of the device. Normally it takes between 3 to 4 months. With the cost of the device, the $14K that I've mentioned, when you purchase a device, you get 3 years of unlimited plan. And with this plan, you can scan as many patients as you want. You have unlimited storage in the cloud. So basically, after 3-4 months that you've paid back for the device, you have a device that generates income for you. You can use this income to grow your clinic, obviously at the same time of saving lives.
Yeah, I mean, you don't have to convince me. I mean, I've certainly talked to tons of folks around the world who are just having tremendous success with this. I mean, and again, like you said, at the end of the day, we always are a little bit uncomfortable, especially when it comes around cancer and talking about profit and revenue and all that stuff. But at the end of the day, we are operating a business, and this is just one other tool. I also like the fact that you guys are really working hard to advance the technology. I mean, you guys aren't standing still. I mean, I can tell you this is a completely different product and even company from a year ago when we first started these conversations at Vertical Vet. So I love the fact that you guys are just in this sort of, skyrocket, accelerated growth phase where you're doing everything possible to make it better. I guess the last thing today to touch on is just, again, that peace of mind component, because you're right. This is a battle, a war against wait and see. I love that you said that. I'm going to steal that, Laurent. It is a war against wait and see, because that's really where patient suffer, right? Because we've all been there as busy practitioners where you just go, gosh, if I'd only gotten to the 6 months earlier. So I think this is one of those issues where suddenly now during the scope of an exam, Laurent, I can say, I'm a little concerned about this is a new mass. It's a new lump or bump. And I'd like to get some answers. And I know, obviously we may not want to do a surgery today, but we can screen it and tell you with high degree of accuracy whether or not this is something we need to worry about. That is worth price of admission right there, Laurent.
Absolutely. And, it's the anxiety, the people can be very anxious, even waiting for the FNA results. And again, I just want to mention that we're not here to fight FNAs or biopsies. We are here to encourage people to do more FNAs, more aspirates, more biopsies, more surgeries. So we want to give them a tool that can give them a very quick peace of mind. And you know what, I can show you a quick slide just to show when this is how the result dashboard looks like on the device. So you get the device, the results on the dashboard. So you can see that immediately when you get a low cancer risk, and in this case, this mass got a 1% cancer risk, which is very, very low. Anything below 10%, we are very happy with. We consider that benign. The low cancer risk is supported by the fact that the algorithms have also provided a lipoma result, which together with kind of getting a low cancer risk and a lipoma, immediately the pet owner is much, much, much happier and can just go home in a very kind of, happy to kind of say that, I can monitor it quickly at home. I guess on the other line, we have this mass that's got a high cancer risk with an alert that potentially they are dealing with a mast cell tumor. So you can see how strong the message is that in this specific case, it's probably better to continue and do more tests. because there is a high risk. And we always kind of say, oh, poor dog that we found cancer. But actually, because we find it at very early stages, very, very early stages of the process, we can help them. We can remove this process. We can remove the lump with good margins, low grade, and the patient can just continue to live and be happy. The fact that we actually found the mast cell tumor is good, because we are now able to actually do something about it and not wait 3-4 months down the line when it's spread and it's all over the body and we can't do much about it. So this is where we are trying to help pet owners.
So we now have this technology in the exam room today, which is just remarkable. I mean, it's an exciting time to be a general practitioner, to have this type of technology. And Laurent, if we talk to you a year from now, you're talking about subclassifiers, it's going to be even deeper. The roster is going to be broader. I mean, it's just going to grow and grow and grow, because again, the more data we have, the better we're going to be able to support these patients.
Absolutely. We continue to collect data. We run lots of studies that allow us to improve the current product, but also create more applications for the product. So we have much more to offer, or we will have much more to offer in the future as well. You just need to try and get it.
I love it. And you know what I really love about this, Laurent? What I love is the simplicity of the concept. I mean, I think most veterinary technicians that are watching this can wrap their head around it, right? I mean, basically, these tissues absorb and cool off heat differently. It's a different type of tissue due to a variety of factors. And suddenly now you're utilizing that thermophysical characteristic to actually use it in action. I mean, it's remarkable. Is there anything, last little bits, so now some veterinarian out there is watching this and they're saying, hey, I get it, Ernie and Laurent, this sounds exciting, but I don't know. I mean, really, what could you do to convince that last skeptic out there who's watching this?
You know what? It's not actually me. It will be my team that will be able to convince them. Because what I would like to offer everyone is just to book a lunch and learn with us. I have a very capable team, a very clever team that can really kind of run through everything with you into details, answer any questions that you have. So if you want to book a lunch and learn with my team, you can do it on our website. You also have on our website, if you want to be convinced, there is a new section that we've added, which is called HT Vista Academy. And in the HT Vista Academy, we offer loads of videos and resources, and not only talking about the HT Vista, but just in general management of lumps and bumps. So you will be able to have access to webinars and podcasts and all kinds of resources that potentially can maybe give you more information before you actually book the lunch and learn with us.
Yeah, guys. And again, if you have any questions, you can always reach out to us at Vertical Vet. We'd be happy. I mean, our team is just as excited about this as I am, and we'd be happy to direct you over to the HT Vista folks. So again, Dr. Laurent Levy-Hirsch, I can't thank you enough for spending some time with us today. This is the kind of things, this is why we made Vertical Vet, back all those years ago, because we wanted to be able to bring to independent practitioners across the United States these types of innovations, this type of stuff that you might not hear about. And so again, I can't thank you guys and the HT Vista team enough, not only for spending some time and working with Vertical Vet, but for doing such good work for pets that we love. I mean, gosh, you guys are changing canine care. Thank you.
Thank you. And thank you for giving us the platform to share our technology.
Well, guys, that's it for another edition of Vertical Vet's Vet Med School. You can see why I was so excited to go and have another visit with our friends at HT Vista, because again, the technology just keeps evolving, progressing, getting better. And we wanted to make sure that you guys knew about this. We think it's an affordable type of technology to add. We think that it's going to enhance your workflow, but more importantly, it's going to allow you to provide better care for the patients that depend on us. So if you have any questions, definitely check out HT Vista. We'll have all the links below and all that kind of stuff. If you have any other questions, definitely reach out to us at Vertical Vet and we'll put you in direct contact. Again, thank you to HT Vista and Dr. Levy-Hirsch for spending time with us today, guys. Go out there, do great things. On behalf of the amazing team here at Vertical Vet, I am Dr. Ernie Ward. We will talk to you next time. Bye, guys.